you are very welcome to a coolish, dark evening in the north of England. Bit of an update on different places today. There's been a little bit of, not exactly debate or tension about vaccines, but we'll think about that. But I want to think about some regional issues first. Now, last night there was really quite a powerful film on ITV about the situation in Russia. So I want to start off there. Now, as we know, for the population, Russia's had a fairly low number of deaths for the population and a lowish number of cases for the population on the official data. To tell you the truth, I don't know why I bothered writing that on. Anyway, getting on to the report, Butova is in the outskirts of Moscow. Now, what they had on this news report is they had some drone footage of the cemetery in Butova as it was videoed in the first part of the year, around about April, I think it was. And it was fairly empty, a lot of green space, and now it was full. Now that's telling us nothing, of course. I mean, it could be that people are selectively buried there in high numbers, so that's quite possible, but that was quite a poignant piece of film, really. I mean, the link is there. Do look at it for yourself and see what you make of it. But that was quite powerful, and that's the link. I don't think I can show you the video actually, so I never quite know how copyright works and things like this, but I haven't put it on. But you can click on it yourself and watch it. For sure, there's temporary hospitals in Moscow that are pretty full, and death rate and hospital admissions are difficult apparently in Tousk in Serbia. There's a video of someone having difficulty getting into hospital. Now, a doctor from the Doctors Association, I'm not going to put down the name of the doctor because I think she's had enough publicity already. In fact, it's fairly obvious she's a woman, you watch it on the clip. But she said the healthcare system in Russia is destroyed and the numbers of cases and deaths are probably about 10 times what they are. Now, this is really impressive that she's done this, that she's spoken up for the truth on this, and I really hope she doesn't fall out of a window, and that's not a joke. I really hope nothing happens to her. But really quite a powerful testimony if you watch that video clip. So, I mean, well, you work it out for yourself. Times 10. Is that 1 times 10? We simply don't know. We simply don't know. But of course, having said that, to be fair, we know that the numbers in Western countries are 10 times what the official data would say in terms of the number of cases. But in the United States and the United Kingdom, what we're much surer about is the number of deaths. We can be fairly sure about those in the United States and the UK. Okay, there's some debate around the edges, but we can be much more certain. Chelybinsk in Russia, and again there was some really powerful video of body bags in corridors. Now, and again, to be fair, there can be particular periods of time when there's body disposal. It's actually not out of the way in the UK for even in a normal year for having to wait a week for a burial. That's not out of the way at all. So it's not necessarily saying anything. We don't want to put 2 and 2 together and make 5. But the situation in Russia is worse than we think, and we really don't know exactly what it is. So we'll leave Russia there. Now, China, this is a very concerning news report. Check it out for yourself. It's on DW. Now, we know that there's been massive mink culls in Europe and the United States, and indeed the worst perhaps with I can't remember, was it 13 million mink killed, some appalling number in Denmark. But the demand for mink fur in China seems to be very high, China and Hong Kong. So the Chinese have simply started farming mink for themselves, and I hate to think what the conditions are like. And we know that when the SARS coronavirus 2 gets into mink, especially if they're all crowded together, they're all in a small space, we know that a mutation has occurred which is really quite different from the SARS coronavirus 2 spike protein that we're contending with at the moment, and that could influence the efficacy of the vaccine, and it could mean another pandemic spreads out of China. And to be quite honest, we've no reason to suspect that the initial stages of a new outbreak in China won't be hushed up, just as the first one was, while the pandemic proliferates. And I've no particular reason to think that the World Health Organization will be more proactive and immediately close down all flights from China, as they didn't announce back in February, March. So that is concerning. And you know already I'm very concerned about the way that we interact with animals generally. And in Asia, it is a particular risk. Now, there's a bit of a debate's too strong a word. Let's just say there's been some slight misunderstandings about the way the UK vaccine has been authorised. Now, I've done this in great detail yesterday. Was it yesterday? Might have been the day before now. We have looked at this in detail. But just to give you a bit of an inkling as well, this is the one I wanted. This is the legislation in the UK government. So this is Regulation 174 of the Human Medicines Regulations 2012 from the UK government. And this is why the UK has been able to get this done so quickly, because we have this special clause, and this allows us to basically skip the prohibitions in Regulation 46. Requirements for authorisation do not apply when the sale or supply of a medical product is authorised by the licence authority on a temporary basis in the response or to the suspected of a confirmed spread of. So if it's pathogen agents, toxins, chemical agents or nuclear radiation, so we're exempt. It's exempt from those regulations. Now, that doesn't mean that the regulatory approval have not gone through the full range of steps that they normally do. They have, and if you click on there, again, I include the link, you can read all about it for yourself. Any amount of information there. And I have read through this in some detail, and I've read through the other publications about this from the UK government, and I would roll my sleeve up now and have it immediately. There's no question about it. So I'm happy with it. But others don't seem to have quite understood this early provision. And you see that the Medicines and Healthcare Products Regulatory Agency were actually, they didn't just start doing this when they got the request on the 23rd of November. They've been doing this since at least the 1st of October. So they already hit the ground running. And of course they get rolling updates on new data as well. Now, if it had been that in the past few days since permission was granted for the Pfizer vaccine on the 3rd of December, I think it was. Now, if the new information had come from Pfizer that meant this was now less acceptable, that they would have withdrawn the regulation, because it's not a once a decision, bang, that's it, get on with it, mate. It is an ongoing rolling review process, and that will carry on once the first people are vaccinated next week as well. So it's very much a process, not an event. Check it out for yourself. So all those links there are readily available. This is all public domain stuff. Now, there's problems though in Europe with people agreeing to take. Before we come on to that, let's just look at this. The date for the European Union, for the rest of the European Union countries, which of course England, UK, England, Scotland, Northern Ireland, Wales are still in, up until the end of December. The very end of December, we're still in the European Union. So the rest of the European Union is having their meeting not till the 29th of December in Amsterdam. And this is just a ridiculous delay. So Italy's health minister, vaccine will start around January the 23rd to January the 26th. So that is like pretty well all of December and most of January. You know, this is good 6-7 weeks, isn't it? Behind the UK when they start vaccinating. A lot can happen in 6 or 7 weeks over winter in Europe in a coronavirus pandemic, as we are seeing. A lot can happen, and yet We're starting next week. They're starting then. It really does beg a credulity. It really does. And this health minister said this means more weeks of sacrifice, financial sacrifice, lives sacrificed. He's aware of this, and yet this is the delay that they're facing in Italy. The countries in Portugal, Spain and Greece are hoping for early January, so a bit ahead of the Italians, but still a full 4 weeks behind the UK. Come on, get a grip, get this sorted. Because this is one thing, so I've just put this down here to remind us that vaccination is not an instant process. So what happens is, with the Pfizer BioNTech vaccine at least, so if someone's vaccinated on day one, they'll get some immunity after about 7 days, but they can't count themselves immune by any stretch of the imagination at that point. So day one they'll get the first dose, day 21 they'll get the second dose, and then it's 10 days after that till they develop a full immune response. So it's a full 31 days delay. So if you factor in that they're not going to be vaccinating in Italy, not even going to start till the end of January, people aren't going to even start being immune until the end of February in Italy. So this extra delay, they just don't seem to get they do get the urgency of it, but it doesn't seem to be happening. I'm bemused. Now, this is what I was mentioning before, France. Now, the anti-vax brigade seem to be gearing up in France. Now, I do not discuss conspiracy theories with no data, because on this channel we do this. Right? If I'm presented with evidence, then okay, we'll have the evidence. But so far I haven't been. So I'm not even going to give them any airtime. Okay, I'll just talk about one. The idea that these RNA vaccines will alter your DNA forever. I mean, it's too absurd. I don't even want to talk about it, but I'm going to. So there's a central dogma. The words were ordained by Francis Crick, as of Watson Crick and Rosalind Franklin, who discovered the DNA double helix. And Francis Crick said, DNA makes RNA makes protein. Right? So deoxyribonucleic acid makes ribonucleic acid, and that's the ingredients for the protein. That's the way it goes. It is not proteins go to RNA, go to DNA. That way it doesn't work. If you're a biologist, it's the difference between Darwinism and Lamarckism. Jean-Baptiste Lamarck said that things could go the other way. So the reason a giraffe's got a long neck is because it stretches up to reach the leaves, and then baby giraffe is born with a little bit longer neck because mummy and daddy giraffe stretch their neck. It's just not the way science works. So if you have some RNA in a cell, that cannot go back to the DNA. The only way it can do that is you've got a special enzyme called reverse transcriptase, as happens in the human immunodeficiency virus, but that's a very unusual case. The RNA that's injected in these messenger RNA vaccines will be degraded in, to tell you the truth, I don't know. I would say 2 to 3 days and it will be fully degraded, but that is the plenty time to make the antigen. So the idea that goes into DNA is just abject nonsense. And even if it did go into DNA, which it doesn't, the idea that it would go into germline DNA, which of course is the reproductive cells, it's just absolute nonsense. So that's the last time I'm going to talk about conspiracy theories, because the bonk, the load of bunk. That's that one. So anyway, there's some bloke who used to be a microbiologist going around causing trouble in France. I'm not even going to name him to give him publicity. But the bottom line is the IPSOS poll says that 46 people in France will refuse a jab. That means only 54% of the French population at the moment say they're prepared to be vaccinated, because of this disinformation. Now, this is why, YouTube, for example, is very rigorous about screening out a lot of this disinformation. And other social media companies are starting to do it now, but people can still put up posts, and then, by the time they've taken down, they've already done a lot of damage. Make no mistake, this means the pandemic will go on for much, much longer because of this anti-vaccine propaganda. Spain, it's 36% will refuse. Italy, it's 35% will refuse. Sorry, there we go. Quite high numbers. Germany, this surprised me. Germany, the country of rigour and logic, 30% would refuse. As it stands, only 70% of Germans would accept a vaccine. I am surprised about Germany, I must say. Germans are usually so scientific, logical and rational. UK, it's 21%. We have less of this disinformation here. So the UK is going to reach herd immunity first, partly because of the disinformation, partly because of the supply that that we've authorised it earliest. And we really don't want to think of this as a race. Now, I think the European Medicines Agency and maybe even the American, the FDA to some extent, have been a bit put out by this. So some of the things Dr. Fauci said earlier on were a little bit... So anyway, he's clarified. We're not going to dwell on that. He's clarified. Dr. Fauci has now clarified that US authorities do things differently than their British counterparts. Of course. Now, as far as I know, the declaration for the approval of the Pfizer vaccine in the United States will be the 11th of December. And 6.4 million doses will be shipped around the United States on the 12th of December. I'm pretty sure about that date. The Moderna vaccine, I'm pretty sure the FDA will be announcing authorisation of that. And they both will be positive, by the way. That they will be authorising both of these, I am sure. The Moderna one will be the 18th of December, so that means that will get shipped on the 19th of December. So people in the United States will be getting vaccinated in December. Just going on to the United States, let's look at some graphics actually. What's concerning me, as you know, we looked at this yesterday, hospitalizations in the States. That data is still 14th of November. It's not updated, but we know they're way higher than that now. So high hospitalisation rates in the States. And if we look at the total, the number of cases, around about 100 million now. So, we can't criticise other countries saying that their cases are massively underreported when the cases in the UK and the United States are underreported here by a factor of about 8 or 9 in the United States altogether, perhaps. And the same is the situation in the UK. Deaths going high in the United States, and we see that Midwest is still a lot of new cases. South Dakota and Minnesota sort of sparring for top position. Now the trends in the United States still going up. We can't make too much of daily numbers, but some sources are saying that daily numbers were over 200,000 on Wednesday, and deaths definitely going up in the States. And winter will be a bad time. Now, moving on to that, so we're in this kind of ballpark now. Cases around about 200, getting on for 200,000. In fact, some sources are saying there has been 200,000. Hospitalised people, we now actually know that data we've just looked at is out of date. It's over 100,000 people hospitalised now. This is putting a major strain on hospitalizations and hospital situations in the States. This should be updated soon and will reflect that. Now, Dr. Robert Redfield, Centres for Disease Control and Prevention Director, has been speaking, and he's not optimistic about this winter. This is just from popular news outlets. The worst might still be ahead. 450,000 deaths by February is possible. It's possible. The reality is December and January and February are going to be rough times, he says. These are direct quotes when I put them in italics. The most difficult time in the public health history of this nation. Well, 1918 was pretty bad. in the States. So is he saying it's worse than 1918 to 1919? The H1N1 influenza pandemic. That's what he seems to be saying. But it's not a fait accompli. We're not defenceless. So how many cases would you like? How many deaths would you like? Well, you can actually choose. You know, the way we behave will determine that. When you want to really get everyone on board, you've got to have a clear, unified, reinforced messaging. So the message has not always been clear, it's not always been unified, it's not always been reinforced. So what you want is, the doctor says everyone should wear masks. Then the epidemiologist steps up and says everyone should wear masks. And then the politician steps up and says everyone should wear masks. You know, we want the same message from everyone. And in the States we haven't had that. And the price is now being paid and will be paid, potentially in increasing death rate up to 450,000 deaths, potentially. Let's hope it's wrong, but it probably isn't. We were still arguing about in summer about whether masks work. Now this is a lament looked back on with incredulity that this argument was still being had. And not only hospitals in the States, the emergency services are under extreme strain as well. So this chap's in charge of the American Ambulance Association, and he's using terms like breaking point. I mean, these are not good terms to use. Now, the UK situation. Let's look at that. So here we have the COVID symptom tracker. Let's see what that's saying. So look at this for yourself. I always post the link. Regional differences in the UK, of course. Wales has just authorised new lockdown measures, quite restrictive ones. But overall, for the UK as a whole, that's Northern Ireland, Scotland, England and Wales, new cases down compared to what they have been. I think the figure in England at the moment is about 1 in 105 people infected. And here we see the overall number of people with it at any one time, and that is definitely going down according to COVID symptom tracker app data. So an encouraging trend, but the winter is not over. These vaccines aren't going to start increasing herd immunity anytime soon. As we've seen, there's 31 delays in immunity, and we're only getting a maximum of, we think, of 800,000 vaccines. That's 400,000 people being vaccinated in the UK. So it's just a drop in the ocean, really. The big hope is the Oxford AstraZeneca one, which should be probably approved by Christmas, hopefully earlier. Let's look at some more figures from the UK. So this is cases, which, as we see, are going down nicely. But still, you know, we've just come out of this circuit breaker, so we're hoping now that the tiered system does the job. Healthcare provision, the number of people actually, these are the new admissions, they're going down. But a lot of people are still stuck in hospital, so very gradual reduction. I'm not showing you the right screen, do apologise, let's go back. So these are the UK, the numbers going down there, we can see that. So they're the people being admitted to hospital there. And these are the number of patients actually in hospital. So it's still relatively high. We did predict on this channel that it wouldn't get as high as that, and we weren't too far off being wrong, were we? But we were still vaguely correct on that. So okay, deaths in the UK. Are starting to drop off, and we know about these lag effects now. So the UK has Well, we're not saying this has gone away. There's still almost 1% of the population are infected in the UK. It's still big. Let's not congratulate ourselves too much. But they're the links there. And of course, herd immunity is not going to start increasing till April, really, as a result of the vaccines. So we have a long winter to go. Now, I was going to do, I've got some things to show you on the Moderna vaccine here. I think I might do a separate video on that. I meant to do it at the end of the last couple of videos, but I always go on a bit long. Do, if you haven't done so already, lots of you have, but do download copies of the textbooks, my textbooks in PDFs. The link is there. I'm pleased to say that it looks like quite a few students who normally can't afford textbooks are able to download these and hopefully are benefiting them, which is the whole point. So there is a donation button on the link with the textbooks. If you can't afford to make a donation just now, please don't. They are there to be read. Of course, if you can afford to make a donation, that will help. That can only help the project. So I'm just going to show you something you might... Now, this book here, especially the physiology notes, well, I think they both are. They're both accessible to the average intelligent lay reader, because what they are is they're designed to take people from like secondary school level into professional life. What is all the basic physiology nurses and doctors need to know? What is the basic pathophysiology that nurses and doctors and physiotherapists and pharmacists need to know? So they should be intelligible to anyone who takes an interest in this. So I'm just going to show you one just in case just as an example. So this chapter here, for example, inflammation and immunity. If I come out a bit, we're a bit zoomed in. There we go. So inflammation and immunity. Can't see it now, I'm not too far out. So this talks about inflammation to begin with. And what I like to, so this just shows you inflammation, for example. Heat, pain, redness, swelling, loss of function is the features of inflammation. And then I put in these diagrams that kind of explain how it's happening. And then we move on to immunity. We've been talking a lot about immunity lately. So innate immunity, for example, it's very important to realise all these innate immune systems that we have here. And these diagrams, you can print them out, you can colour them in, it's all in PDF. Different types of immune cells. Here we see the B cells, which are so important. Here we see the T cells, which we've talked about and how they work. And here we see the way that the cells proliferate during an infection. And here we see these Y-shaped antibodies that grab onto these hand bits here, these dark bits, grab onto foreign material like that and clump them together and kill them in lots of ways. Here we see some neutralising antibodies. So there you go. It's and if you fancy going on to genetics, you can do. We'll cover all the main systems here. So if you want to know about livers. Livers are pretty important. I mean, livers are brilliant. Shows the way the blood flows around the liver and different bits about the way the liver is structured and organised. The liver is such an underrated organ. It's just the microstructure to the liver is just absolutely mind blowing. If you're slicing a liver up on the bench to make liver pie or whatever you do with livers, you think it just looks like the same all the way through, but the intricacy is just mind blowing in livers. But there again, every system is quite amazing. So feel free to read about it for yourself. And what you can do with this, if you get the PDF, you can print out a chapter, read a chapter, colour in a few pictures, or not, entirely up to you. Okay, I go on too long. Thank you for watching, as always.